Joining us right now is Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Of course, he is also on the president's coronavirus task force. Dr. Fauci, thank you so much for being with us at this critical time right now. I want to start with where we are exactly in this country at this moment. We are seeing school closures. We are seeing events canceled, a complete change in how we are all living our lives. How bad is this going to get before it gets better?
Well, it's certainly going to get worse before it gets better. And the kinds of mitigation strategies, containment and mitigations that you're talking about, is to do that kind of physical separation of people, which is one of the very effective ways that you can really mitigate the spread of the virus. If you look at the pattern of viruses, particularly these types of viruses, and even look at what's gone on in China and in Italy and in South Korea, you go along like this, the way we were, and then you have a big spike that goes way up, and then after a while, after much disease and suffering and death, it comes back down again. The purpose of the mitigation is to get that peak and to blunt it so that it's a bit of a hill as opposed to a mountain. We're at a critical point now, more in some regions of the country than in others, but in general, the kinds of things that are going on will hopefully make that blunting of that peak so that we could save a lot of lives and save a lot of illness.
But to be clear, we have not peaked yet.
No, there's no doubt that we have not peaked yet.
I think it's frightening for a lot of people to see what we're seeing in places like Italy and places like China. Are we working toward a gradual shutdown of our country here at home?
You know, it's very difficult to predict, Cecilia. I'm not sure we're going to get to that. I think that would be really rather dramatic. But I can tell you that all things are on the table. We just have to respond as things evolve over the days and over the weeks.
Dr. Fauci, if the most vulnerable group is the elderly right now, we're seeing all of these school closures around the country. Is that the right move for children and families?
Well, I think it should be done in a proportionate way. And I think what's going on right now is generally an appropriate approach. But people need to understand, even though it's clear from our experience that children, young adults do very well for the most part. They are not the most vulnerable, but they do get infected. And if they get infected, and the crowding of the school is a perfect place for that to happen, they may do well, but then they go home and there's grandma and grandpa and an uncle or an aunt or a mother or father who actually have an underlying condition that'll make them more vulnerable.
You know, this testing is top of mind for so many of us right now, and you made some headlines with your very candid and blunt assessment of the state of testing. You said the health system is failing at providing adequate testing when you were testifying before Congress. Dr. Fauci, are there people who are walking around right now who have the virus and don't know it because of this lack of testing?
Well, I'm not so sure it's because of the lack of testing. But I think clearly the system as it was originally designed was very good for what it was designed for. Now looking forward, we're changing it rapidly. So, you know, rather than playing Monday morning quarterback, let's look ahead. And I believe what we're hearing at the task force, that we are now getting into that phase where we'll be able to really scale it up a lot. I think in the next week or so, you're going to see an acceleration of availability of tests.
Well, I want to get your take on the messaging from the White House right now, because it was just yesterday that President Trump himself said that, frankly, the testing has been, quote, very smooth. Are Americans getting mixed messages on this front? Is it accurate, Dr. Fauci, to say that the testing has been very smooth?
Well, you know, I think, again, I don't want to be getting involved in contradicting or non-contradicting. Right now, as I've mentioned many times, and I'll stick by it, early on, the way the system was designed, as good a system as it was not amenable or designed to approach that broad blanket testing. We're on our way to that now, and we'll be able to do it relatively soon.
Well, I'm sure you've heard what California's Governor Gavin Newsom is saying. He's saying many of the testing kits that they've received there by the government are missing key components. He's comparing this to he's comparing these testing kits to printers without ink. Isn't that just unacceptable at this stage?
That was an unfortunate situation. Right now, it's being corrected and is being corrected.
Okay, I've got to ask you just quickly about President Trump and the photos that I'm sure you've seen of him standing next to the Brazilian official who has since tested positive. People are of the mind, I think, that if you come into contact with someone who has tested positive, that you yourself should be monitoring, self-monitoring, or perhaps even in isolation, getting tested. Should all of those things apply to the president?
You know, I leave that to the president's White House physician, who's an extremely competent individual who I know well, and the decisions there would be between what would be a potential patient and the physician. So I'll leave that decision to them.
But if you came into contact with someone who tested positive, would you yourself get tested?
Well, it would be the circumstances. Likely I would, but, you know, I'm not sure. It depends on the circumstances. But I think we should follow the guidelines of the CDC about when you are at a risk, what you should do.
And finally, Dr. Fauci, as people are working from home today and we're seeing these shutdowns all over the country, what's your message? How long are we going to be living like this?
You know, it's going to be at least a matter of several weeks. I mean, it's unpredictable, but if you look at historically how these things work, it'll likely be anywhere from a few weeks to up to 8 weeks or more. I hope it's going to be in the earlier part, let's say 2, 3, 4 weeks. But it's really impossible to make an accurate prediction.
Dr. Fauci, thank you so much for your time this morning.
Good to be with you.
Well, that is just a sobering and an honest answer there, that we could be looking at another 2 to 8 weeks of this.
A lot of patience required.
Yes.
And thank you, Cecilia.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.